85% of people are visual learners. They learn from what they see. But for Anna Michio of McFarland, much of what she saw didn't make sense until she underwent vision therapy.
How to think of 5 places in your life where you use numbers. Okay.
As a 4th grade teacher, Sharon Michio knows firsthand how vision issues can impact a child's ability to learn.
So I would say every year I probably see 2 or 3 kids in my class.
But her knowledge goes beyond the classroom.
Billy was collecting a list of how many.
Her daughter Anna once had pretty severe vision problems.
When she was in kindergarten, we noticed that her handwriting, it was really difficult for her to form letters. She was reversing letters a lot. So not really wanting to look at books.
At first, Anna's parents suspected dyslexia.
So look at the ball.
But research led them to developmental optometrist Kelly Knippel, who specializes in vision therapy. After a comprehensive eye exam, it was determined Anna's issue was not dyslexia, but rather an issue with how her brain and her eyes were working together.
She has 20/20 vision and did back then as well, but her eyes, we found out through these tests, were not working as a team and they weren't focusing together.
Anna had what Dr. Knippel calls pretty common vision problems that could be corrected with vision therapy.
Mostly we're working with developing visual abilities, teaching the brain how to see, as well as getting the eye muscles to coordinate and work together.
Anna went through 9 months of treatment.
So this is a test to see how your eyes can keep their place.
She would make one visit to the vision therapy clinic each week, where she'd go through simple exercises like the ones you see here. She'd also practice 15 to 30 minutes at home each day.
Excellent. So that was 21 seconds.
It wasn't always easy, but Mom says the results were dramatic.
It completely changed her personality. She went from being just kind of depressed almost to this really happy-go-lucky, sunny child who now reads constantly.
Some insurance companies do cover vision therapy. The Michios did not. They spent about $5,000. It's money they say was well spent.
It's money I would spend again every year if I had to.
If you're wondering if your child has a vision issue, there are certainly things you can look for. Does one of their eyes drift slightly? Do they turn or tilt their head to see, or squint or blink frequently? Also, when looking at books or objects, do they hold it unusually close to their face? Do they close or cover up an eye? Or do they rub their eyes a lot or frequently lose their place while reading? Kids with vision issues can also complain of stomach and headaches frequently, even to check with a doctor. For the Parenting Project, I'm Kim Svem.